Recording in progress.
Good evening, everyone. I'm Dr. Donna McDaniel Mitchell with the Laborers International Union of North America. It is both my honor and my distinct pleasure to fill in as your host and moderator for Everything's Health program tonight. Our APRI National President, Cleola Brown, is on the road and as always is fighting the good fight for our brothers and sisters in the United Mine Workers. Every year since 2009, the A. Philip Randolph Institute has featured health symposiums annually at our National Education Conference. We've explored healthcare topics from dental care to high blood pressure, childhood obesity, and mental health, including depression and suicide. Among the many health professionals that are presented at our conferences is Dr. L. Tony Lewis, who is our featured speaker tonight. Dr. Lewis has also assisted in coordinating many of the APRI health symposiums over the years. She brings a unique perspective to APRI's healthcare advocacy work. I'm pleased to introduce my sister, Dr. Lewis, who many of you refer to affectionately as Dr. Tony. Many of you are also familiar with her work during her tenure as chair of the healthcare division of the 1.1 million member labor union, SEIU. Dr. Lewis has led in many areas under SEIU, including implementation of the Affordable Care Act. However, it is her work in help to lead and craft education, preparation, and response to the 2014-2016 Ebola epidemic, which has led her to become a leading expert in traditional health care, as well as global holistic strategies for health justice. In 2018, Dr. Lewis stretched her wings and founded her own company, Liberation Health Strategies. In this space, as president and founder, Dr. Lewis focuses on local community, national, and global holistic strategies for health justice. We are so proud of our sister in all of her accomplishments, and I'm asking that you join me now in welcoming her to our conversation tonight as we talk about how the COVID epidemic has impacted our mental health and explore best practices for coping with its effects after. Please join me in welcoming Dr. L. Tony Lewis. Dr. Lewis.
Thank you so much for that lovely introduction. And hello, APRI family. My goodness. It's just, I miss you all so much. I really, really do. And I love you and trust that me and my family are praying for all of us and all of you in this moment. It is no light thing that we are able to gather here today on June 30th, 2021, halfway through this year. It is a blessing, honor, and privilege to be with you, A. Philip Randolph Institute, and definitely shout out love and prayers and appreciation to our leader, President Cleola Brown. May she travel safely and arrive safely. And we know we will bring the spirit of her questions, her requirement for answers, and her inspiration that we actually act to do what's best for our people today. So I thank all of you for being here, and I'm looking forward to this conversation today. Hello, I see people in the chat. I want to, kind of frame, just frame a little bit. I really appreciate the introduction by my sister, my Dr. Don. Are you hearing an echo?
A little static, but we can hear you.
You can hear me? Okay, great. And so one of the things that I think really calls to me about this particular conversation with you at this moment is, if there's ever a time when our community, our children, our elders, our essential workers, all of our workers, our families, our new babies, and our people transitioning need organizers. need people who know how to get the facts and speak up and speak out and fight for what we need. It is right now. It's right now, because this COVID situation, I mean, you all already know, like, I'm sure as you were listening to Dr. Donna talk about the title of today, like how we, how we, cope with this epidemic, how we think about after. I'm sure all sorts of things already just started popping into your head. The first thing that popped into my head was after. What after? Who's after? Because I'm here in Bed-Stuy, Brooklyn, New York, and I don't know about where you are, but there's a group of folks that aren't on this call that are acting like we already done with the COVID pandemic. And we know we still have work to do, that our worker fam is at risk with folks, with variants and things, and that around the globe, we are facing all sorts of challenges. And so today in our time, I'm gonna talk a little bit about what what I think our role could be to help us get beyond this pandemic to our space. But also, I really, really, really want to hear questions from you. Really do, and just keep the conversation going. So I don't know if you have any questions to start, or you want me to?
We do. So Dr. Lewis, just I guess piggybacking on last week's program. Last week, our audience heard the statistics on how our Black and Brown communities have disproportionately been impacted, not by the pandemic, but also in the disparities related to receiving adequate health care and in gaining access to the vaccine. For example, many of our apprehensions were heightened by the mere fact that the vaccines and treatments were new in some minds, so that they were experimental. So from perspective, what do the numbers look like when these disparities affect the Black and Brown community with respect to how we are coping mentally and emotionally? How are we in this area?
Excuse me. So how are we in this area in terms of coping mentally?
Yes.
With everything. And this is one of those things where I could probably give you a lot of numbers, but I think as organizers, you already know, what it feels like and what it looks like. So I will start with saying that, like, I appreciate that in my time as healthcare chair and vice president over at SEIU, the work that we were called to do with the A. Philip Randolph Institute, under the leadership of President Brown, and all of you always called us to think about our bodies, minds, and spirits, in this space. And so we talked about mental health. We talked about like what it was like to put our bodies and spirits on the line for all of the work that we were fighting for. And so we know that before we got to COVID, we were starting with a situation, right? We were starting with a situation where we had already talked about where we were already talking about housing and education and pay equity and all of those things. So now put on top of that, this pandemic, this historic time, right? And I don't know that we have a word that really, really fully appreciates the stress, and the impact of that on all of us. And so just to start, I remember right before we got on this, our leader, Fred Mason, was talking about how in Baltimore, one of the things that folks are not talking about a lot is that the number of suicides is actually double the number of homicides, and we're hearing about violence a lot in the news all over the country right now, but like this idea of how this is showing up in our children, whether it's suicide, depression, burnout, stress, like all of these things, the fact that we had the COVID, kind of pandemic in what we call the disproportionate amount of grief. Like what's the numbers of people to folks is our families. Like I would ask how many of you knew people or lost folks, but that hits hard, that's one thing. And so all of the stressors, all of the things that we see could be potentially exacerbated. So depression, anxiety, and as I mentioned, burnout and stress, especially for folks who have been essential workers or frontline workers or mortuary workers or organizers. Because, as organizers, we hear all the things. We hear when the children are having issues, we hear when the air conditioning is out or when the heat is out, all of those things, but all of those things do actually add up. So I will say we are definitely dealing with a challenge with our mental, physical, and spiritual health, partially because we've been focusing so much on COVID, but all of these other things, whether it's your hypertension, your diabetes, or just the how you doing, how you feeling, kind of thing is critical right now. And it's really important to understand that, like, for our mental, physical, and spiritual health, and I'll just focus on our mental and spiritual health, we know that not every doctor, not every therapist, not every person that looks like us knows how to serve us. And definitely the ones, it's not, we are underrepresented in terms of what we do. And so it's important for us to inventory all the resources we have, whether it's your church family, your healers that are doing things, whether it's dance that keeps you straight, whether it's your cooking that keeps you straight. All of us needs to have a list of things that nourishes and pours into our spirit, and then a list of people that we call when we have an issue to be able to navigate this moment. So I will drop some resources a little bit later in terms of where you can find Black therapists if you're interested in that. Also suicide prevention, violence hotlines, there's all sorts of things happening. But really, honestly, if I think about even me going out for my morning walk, excuse me, 2 days ago, and I went to my left, and my neighbor, who's retired corrections, was talking about how she was stressed because it's the anniversary of her sister's death, and how she's having neck spasms and how she's about to cry. And we talked a little bit about strategies and how to tend to her body, and how she was ready to go back to church, and all of those things. And I took 3 steps to the right, and Miss Joan, who's currently in the Department of Education, just used the word done. Like, I'm just done. I'm done of taking care of everybody else. And we talked about, how to, find resources or when to ask for help. But I think one of the really significant parts of this moment is, there's this thing called survivor's guilt. For those of us who either survived COVID or are still here, almost feel like we're pushing a little bit more because, oh my God, if we're blessed, we better push. And this is a moment where we need to take an extra step to take care of ourselves and each other.
Well, Dr. Tony, when we started, you said that you really wanted this to be very interactive.
Mm-hmm.
Really answer questions. So I want to actually now expound on the Q&A features. So for everyone who's on the call, please provide your first name and where you're from before you ask your question. So I'm going to open it up for questions for you, Jan. So we have Wilhelmina Daniel.
Mm-hmm.
All right.
Right. Am I unmuted now?
Yes.
Okay. So
I think I am frozen.
I'm in the Seattle, Washington area. And I was glad to get on this because I wasn't sure what time zone it was.
Okay.
One question that came up was regarding COVID-19 is that the person didn't want to take the vaccine because it had a problem with someone becoming pregnant and she wanted to have a baby.
Mm-hmm.
So I was wondering if this is some type of a myth or, and then I want to throw this other question out, is that, as a people regarding therapists, even though they may be available to us regarding the suicide problems and stuff, that they don't want to contact. So how can we try to minister to people to take advantage of a therapist?
Mm-hmm, mm-hmm. No, thank you so much for those questions, Ms. Wilhelmina. So on the first question about the vaccines and pregnancy. So, one of the things I'm going to level set every answer with is that all of these things are kind of new and evolving, and we're learning, all along the way. So as of now, I actually have several folks who are kind of considering pregnancy. And what we are suggesting is that they stay, do their best to stay healthy, to have, and this is pre-pandemic, this is before everything else. And so I would say, definitely the person should talk to their doctor and do everything to be healthy. The vaccine may be a consideration, absolutely, because, well, as we know, what COVID can do to the body in terms of the airway, in terms of the breathing, in terms of the resources that's needed to recover. We want to give the baby like the best chance possible to survive. And so there are a lot of myths out there, in terms of what could happen, especially depending on the vaccine. My favorite resource, especially for Black mothers, I have two. One is the Black Mothers Matters Alliance. They're based in Georgia, but they work nationally and globally. A bunch of Black women, doulas and midwives, they will bust the myths, they will tell you the truth, and they will tell you, how to work towards a respectful, joyful birth. The second one that I love is a great friend of APRI, Dr. Joya Crear-Perry, and the National Birth Equity Collaborative. And they're New Orleans based. I don't know if you know them, Dr. Donna, but they also do a lot of work to kind of make sure that the right information is out there. And they actually just had a seminar, I believe on Monday, where they talked about COVID questions and Black mamas and pregnancy. So I would definitely go to that. And then in terms of mental health and encouraging our people to, I would say, use all the tools. Use all the tools, whether it's therapy, or talking together in a circle or a group. There are actually some great, my sister Siobhan Arline Bradley actually did a sermon on this, which you can look up, and I'll put the link on the website a little bit later, from Alfred Street Baptist Church, on kind of, making sure you grab all of your tools and, you get to, your therapist and how to approach that conversation. But I think, for me personally right now, we've worked so hard and we've been through so much. Don't we deserve all the things? And for me, I was raised that, when you pray over things and you use that spirit of discernment and you talk to your folks, like, what is of God and what is for you and what serves you. So I would encourage applying that lens to this moment, especially, and having that open conversation. And I would also say, and I'm gonna shorten my answer so we can get to more questions. But I love y'all. I love y'all. I would say you interview your therapist like you interview anyone else. So if you're in there and it doesn't feel right, move on. Find someone for you. Thank you for your questions.
So do we have another question? Well, while they are thinking of questions, I'll ask one that we pretty much talked about earlier, which was, how do we deal with anxiety when we are out in public?
So there are many ways to deal with the anxiety. First of all, if you are feeling anxious or feeling your nerves or feeling some kind of way about being out in public right now, congratulations for your body being attuned to the fact that this is not your normal summer. And so, I would say, there are many kind of strategies that folks have used over the years to kind of think about, how to work with their minds, bodies, and spirits with their health in order to navigate stressful situations. So, the first thing I will say is, before you, don't just rush out there. Take a moment, take a breath, prayer, breathe, be quiet, whatever it is, just to kind of think about what you're doing and ground yourself so that and recognize that this is, kind of a new space. And for many folks, like, that anxiety is a little bit about the, I don't know who's vaccinated and who's not. I don't know who's going to try to come in my face, or am I going to get in a situation where I'm around too many people? So I would say plan your movements, like, very specifically. Plan your movements in a way that you are kind of managing your energy, as if you were sick or cautious, or just trying to figure out, like, how to make sure to navigate your spaces. And so, for example, this weekend is a big holiday weekend coming up. Think about the fact that depending on your city or where you are, there will be tourists, there will be folks that are out at barbecues, there will be all of these different things. And if you decide before you go out, just like if you were going out to a party or going out to a barbecue or going out to a parade, that look, if these things happen, here is my exit plan back. And here are the things I need to do to make sure I'm safe. Those are really, really important ways that can help deal with the anxiety, because a lot of times what I'm finding with people that I'm working with and talking to that are really struggling is, the scenario where they get out there and then they feel overwhelmed because they're surprised by the number of people or by how tired there are, or by the fact that there's not as many trains or not as many buses or not as many workers to help them out. And so yeah, so as much as you can plan ahead, I would say definitely do that. And if you come to a place where you feel like you're a little bit short-circuited, like you cannot shut down your nerves, you cannot sleep, you're really afraid, that's when you should reach out for additional help. Reach out to friends and families, to your doctor, to your therapist, to a support group, to someone, just to kind of have a touch point to see if there are extra things you need to do in order to prepare for this space. Thank you for the link, Angela. The other one was the National Birth Equity Collaborative, NBEC, NBEC. So absolutely. So, it's interesting to me, and thank you for the question, for the prompt, Fred Mason. I really appreciate you as we talk about what's going on in terms of the disparities that exist in care, in our primary care, in our general preventive care. And so we've heard this at our national education conferences several times, that either we tend to be less likely to be screened for certain diseases, we tend to be less likely to get, certain preventive care, or, have a doctor that we're seeing. And I'll say that, even though sometimes we talk about it as health disparities, which just means differences. And, in the United States, this whole thing about, if we get a cold, then, if the rest of the country gets a cold, we get the flu. These things kind of pop up in terms of like our prevention, because there's that other phrase too, where it's like, if we're, what is it, an ounce of, prevention is worth a pound of cure. Like we know that. How many of you all heard that from your elders? And so there are disparities that exist in preventing all of these things. First of all, because our medical system actually focuses more on disease than prevention. So there's that part of it. But the second part is that we need a focus on not just prevention, but on how we stay well. And so that kind of thing, where we have doctors and nurses and healthcare providers that see us as fully whole, fully, deliciously, wonderfully, beautifully Black, and contributing and worthy of life and joy and liberation. Having that kind of mindset in our care, in our healthcare team, is critical to our well-being. And so how do we level set that? I think one of the ways that you can find your healthcare team, depending on where you are in the country, where you are in a big city, because I can tell you it may be just as challenging for me to find like the right healthcare system in Brooklyn, Bed-Stuy, as it is for my mom in rural Southern Illinois, is really just to kind of ask around, like inventory your people the way you would organize any other campaign. Like I would say right now, as we're getting ready to head into the summer and the fall, and we're thinking about variants and vaccines, you need to get your plan, get your inventory, and see who your health team is that really cares about your prevention, your wellness, your ability to march, to fight, to dance, to all of the different things. Because to be clear, we've got a lot of healthcare workers, a lot of doctors and nurses that are shifting because they're burnt out from the last year. And the person that was there for you a couple of months ago may not be there for you now. So I would say, check around and like get your healthcare team together, because these disparities exist because for years and years and years, just like folks have been fighting us on labor rights and fighting us on our economics and our housing, they've been fighting us on the love and the health of our bodies. That's the big picture of it all, and everything else kind of triggers from there. But we know, just like every other campaign, where there's a problem, we can identify, we can fix it. I think you're on mute.
Do we have another question? Any more questions? A lot of greetings.
Hey, Miami-Dade. Hey, Central Virginia.
Yes.
So let's get into this vaccine conversation a little bit, and I'd love to hear thoughts and comments, drop them in the Q&A. And, please let me know if there's a question, because we are at this point where, depending on your state, your country, your municipality, whatever your turf is, let's speak in civic engagement terms, right? Let's speak in that, like, get out the vote terms, your numbers in terms of the vaccines and the conversations may be lower than folks who are white, lower than folks who have more money, lower than what we need to be to live through this, despite the fact that we've seen so much suffering. And I think what's important,
all right.
what's important in terms of the way we approach this conversation, use all
Okay, we do have a question. What can I do to prevent my anxiety from turning into aggressive confrontation when dealing with the public?
Oh, that's a good one. What can you do? This is one of those things where, and I see you, Bert. Thank you so much for the question. Miss all of my family. This is one of those things where there's it's practice, right? It's almost like, how we practice to be out dealing with confrontation with racists when we're marching. I mean, you all have that story of when you're getting ready to do an action or getting ready to speak up or strike in a particular place. In some ways, we are kind of in a similar situation with the folks who will yell at us for wearing a mask, or we'll come in the face of one of our family, our elders, our babies, or whatever. And I think part of it is to practice kind of getting away from the situation, how to decrease it. But I would say, what can I do to prevent my anxiety from turning into aggressive confrontation when dealing with it? This is all of our de-escalation, right? This is all of our civic engagement organizing techniques. So I would say the first thing is to do your best to try to think about like where you're going when you're in public, so that you can not be in these situations. Of course, prevention, we're back to that a little bit. But when you're there, kind of making sure to assess, to ground, to breathe, to know that like this is not kind of a rational thing that's coming at you. And if you feel that your heart rate is starting to go up, your fight or flight is starting to go, that like we need you around a little bit longer. So I would say, take that opportunity to push back and have a touch point to kind of, really to release, and then release it later. If you feel like you cannot control it and you're overwhelmed to the point where you feel like you need to assist with control, I would say look for friends and family to get in with that about, and potentially get to some therapy, because that could be trauma induced PTSD, any number of things. But the first thing is somebody. Mm-hmm.
Great. We have another question, and you're right. All of the heightened, escalated activity on the planes is pretty scary. You know how people are just really losing control. So we really have to try to control our reactions, I guess.
Yeah. I'm actually really concerned as we enter the summer and we have heightened stress, heightened job loss, all of these situations. So I would say, just like we were looking at last summer as being, increased kind of violence, there's road rage, all of these different things, walk out the door with that awareness that you are more likely to encounter somebody that's over the edge, and prepare yourself accordingly.
Yes. We have another question. What can be done about the shortage of Black doctors and the trust of vaccines?
So many things. And so right this moment, I would love to like do a magic wand and have every Black person who wants to be a black doctor do that. I would say, first of all, find all the ones that you can online, National Medical Association, blackdoctors.org, look at the Student National Medical Association. There are all of these different groups, and you're seeing more and more of us coming out, and I could run a list of them for you. So start there with like lifting up the ones and supporting the ones that are available, because we are really trying to support like at every level, making sure that we have more doctors coming forth. I would also say support our nurses, our Black healthcare workers, all of our, because we need all of us that care in the space to like fill the gaps, because we are so behind in terms of the number of Black doctors to Black people that we need the full, so like the full team. So like with maternal care, there's, you know, doulas, there's midwives, there's nurse practitioners. You know, I would say find the really good teams and then support our youth and our folks at all stages of their life that want to go into medicine, you know, to like kind of move that forth. And with the trust of vaccination, I would say I'm gonna go back to that civic engagement organizing conversation that we know how to do so well. You know, never, not ever have we won a campaign by telling people they were stupid by not voting. I would say let's use that same logic to listen to folks, to figure out, like, if you're at this point and folks are still not wanting to get the vaccine, find out exactly what that is. And I promise you, there are a couple of resources where you can get like good answers on the myths. But like I would say, let's have respectful conversations with our folks, because people have been through it and they may have a good concerning reason or may have gotten some misinformation. But we do this well. We do this well. We know how to get to the truth. We know how to make the choice. We know how to take the risk to do what's best for our people. And for me, that was the conversation that me and my mom had, that like, look, my people are suffering. I want to do what I can to try to not be suffering myself, not have my community suffer, and not have the workers who are like in tears because they've had to see so much death and suffering, grief. Like, I'm looking out for my brother and my sister that way too. And so I'll take the risk, you know, but that is, it is a risk. And so let's have that true, honest conversation. We know how to talk facts at APRI. We do.
As we talk fast and actually come to a close, we have one more question, and it's from Alda McKinney. So we missed this question earlier, but she's asking, as schools open, which many of us are all concerned, many educators are concerned too about being exposed to the virus, and if they are at risk, how to make the educators feel more comfortable at school.
Yeah, thank God for unions, right? I'm just for real, I need a t-shirt. Thank God for unions, thank God for APRI, because I've been working with the Global African Workers Institute with like labor unions and workers around the globe about like the best practices to fight for that. And so, you know, really making somebody feel comfortable, right, in labor life is really just about creating the respectful conditions that we fight for, whether it's in our collective bargaining, whether it's in our kind of, you know, labor management, whatever it is, it's about that piece. So I would say it's more a focus on making sure we have the right conditions for safety and advocating for that, hollering when it's not right, you know, and then using our, you know, the power of our organizing and our labor to fight for it. Because just to tell a story, and I know we're heading a little bit over, in New York, it was really like, I remember talking with my friends at the teachers union at U of T about like how before it became a big story about the disparities, you know, of what was happening with COVID, about how Black people were dying disproportionately due to COVID, you know, they were already running lists of teachers and principals, and you know what I mean? And so I think as frontline workers, we should see ourselves as informers, as critical to getting out of here. And like, if you feel uncomfortable, it's about creating the conditions where everybody can thrive. And let's use the best of all of our labor fight, you know, and truth to make sure that's the right thing for us.
So as we are coming to a close, it's almost time for us to close out. I want to make sure my LiUNA brother, Paul Thompson, who is over APRI out in the Washington State area, he asked, what can we do with people who don't want to get to the vaccine or who are afraid of traveling? Have we pretty much covered that?
I think it is the conversation on don't want to get the vaccine, right? Because it is about creating the conditions. So that's organizing. We know how to organize. We know how to listen. You know, in terms of travel, you know, that's another thing to prepare for. You know, as we get into the summer, is a lot of people are really, really about to travel. So like in that kind of stepping out anxiety piece, there's the, you know, let's talk about two types of travel. One is the kind of vacation travel where you're going to see your grandma, your auntie, your kids, you know, the people that you haven't seen for a while. It's you and all of them. So just be prepared for that, and be prepared with your mask, your double mask, and all of the things. But also, if I would say, wait a little bit if you can, or check the path for people who have done that travel to see what you need and what's available to you. Because it's getting very crowded in some spaces. And with these new variants, I'm a little concerned that if we don't check that movement, like we're going to be in a not great place in the fall. When it comes to kind of the movements within your city, a lot of folks are concerned about going back to work. Again, hallelujah for unions that are having a conversation about like whether or not to stay remote, whether or not the, workplaces are safe, have the right ventilation, whether or not you're asking about vaccines, all of these things. What resources are you providing for me to be safe, in my body? I would say just take a moment and ask and fight and grab your union folks and organize and just make sure that path is right. Because not everybody needs to be rolling back right now. We saw, some of us, some spaces did okay. We've changed the way we work, but like if anybody knows how to make it work and innovate, it's APRI folks. Y'all know how to do the daggone thing. We sure do. So,
and I think sometimes we just have to be selfish and do what we feel is right. I mean, I'm Catholic, so we've gone back to church, and I was on Sunday, and it's become more crowded, and I just moved. I didn't feel comfortable, even though I had on my mask. So you have to worry about what would people think when I move. You just have to move to a space that gives you more space, or do whatever you think that you need to do to make you more comfortable.
And I'm gonna say thank you for that. Yes. One is that whole, what do the stewardess flight attendants say? Put your mask on first. Right? Like how are we helping, organizing, building liberation, doing all these things, solidarity, if we sit here coughing and we know what that looks like and feels like. The other thing is it is like quite a blessing to still be here right now. The fact that I can talk to you right now is not lost on me, that I am here for a reason. It's June 30th, 2021. God, my ancestors, all my people have poured all this into me, and I'm supposed to do something with that for my people. And so stewardship of that gift means I'm protecting it when I tell you to back up off me without your mask. I'm protecting my gift so that I can do what I'm here to do. And like, look, A. Philip Randolph Institute and all my labor fam and all of you all, I will say the same for every single one of you. Like, if you are here for a reason, you're here within the sound of my voice. Protect that, honor that, be grateful for that, and then, take care of it, nourish it, and then step forward with the swagger that y'all do.
Yes, I answered the phone yesterday and I said, how are you doing? And that person said alive. And so that's true. We're here.
That's the thing.
We do have one more question from Brother Anthony Spivey. And the question is, can you talk a little bit more about the new strain of COVID that's coming to cities near us?
So let me tell you, this nerd me is following this bug like, oh my God, this is the most innovative, likes to switch it up, likes to come from, just let's think about it for a second. Like, think broadly about like when you heard about the first set of COVID cases, what that was feeling like. People were feeling in the throat, they're having trouble in the chest, And then when we got to like the second or third variant, it was hitting people differently, right? It was hitting people who were a little bit more healthy, people who had been doing all the things, and all of a sudden they got it, and so the COVID, got a little sneakier, right? So what I'm reading about like this, and thank you for the movie, because I hear the movie voice now coming to cities near us, right? In terms of what they're calling the Delta variant, right? Yeah. And I'm glad they rolled off of the naming it after a city, because that can get into all the isms and the racisms and the who did it. No, it's not that. So Delta variant, it's interesting that, so first thing to know is that not every COVID test in the United States tests for a variant. So like whatever the numbers are, you see, just assume there's a few more. Just assume it's already here and it's around. And what I'm hearing clinically about the Delta variant is it's a little bit more aggressive, more likely to be contagious, and hits a little differently. So it may almost feel like to some people, hay fever, like a lot more runny nose and sore throat, a little bit less cough, like it's weird, but like it's there, it's more contagious. And I'm also seeing in some parts of the country where there's some concern as to whether or not vaccines are hitting it or not. But all we know is that just know this, whether it's Delta, Gamma, Zeta, whichever variant of this we're going to get to. And yes, my mom is a Delta. So there's a whole thing.
I know you noticed my red and white.
I did see your red and white. I am so a legacy.
I was
And
trying
I'm
to
just
get
waiting.
right on track. Yes.
Look, I'm waiting. I am so waiting on all of my Delta friends and all of my people, my legacy folks, to say something about the Delta variant and don't you
Yeah.
try it. You know what I'm saying? But that being said, just know there will be other variants. And what we need to know is that this ain't over. This bug has been smart. And as long as we have, because we don't only have pockets where we're not fully vaccinated in the US, we have whole parts of the world. You know what I mean? Especially when there are countries that look like us that can't even get to think about getting vaccines for another year or so, let alone vaccine like to the level of. And with people starting to travel globally, you know, there's a chance. And so that's a little bit, I would say, stay with one of the other resources that I love is the conversation between us about us, which is actually sponsored by Kaiser Permanente and a few others. And they have a whole list of YouTube videos where Black doctors, nurses, and educators keep up on these things. But yeah, that's the thing to know. Nerd me wants to tell you, like, this bug is smart. Whatever you would do if you were a virus to try to get in the next time when somebody figured you out, that's what it's trying to do. So this one's doing it a little different, but for now, like the same precautions, staying away from it, wearing your masks, making sure you're vaccinated, just do the things that your aunties and them have told you to do to stay, that have kept us here for 400 plus years. So.
Well, on behalf of President Brown, on behalf of the board, on behalf of all who joined us this evening, I just want to say thank you, Tony. Thank you, Dr. Tony. Thank you, Dr. Lewis, for all of the good information. Those of you who are on the call, I hope that you have your chat box open so that you can see all of the different resources that have been provided to you. And I'm sure that they'll, actually be on the website.
Mm-hmm. And thank you, Sun, for having me.
All right, I just have
It was a
one quick
pleasure.
announcement, real quick.
Mm-hmm.
Just want to announce for next week, we will have Dr. Ronald Copeland from Kaiser Permanente next week. Also want to say great job, Donna, for stepping in for Ms. Brown. Dr. Lewis, very precise, on point, good information. I think I nodded my head through the whole conversation because great information. But I will turn it back over to Donna and Dr. Lewis for last words. You're muted, Donna.
Outside of my technical issues, I'm very glad that we could all get together. I think it said for us, and that we should all get together to talk about things that are happening to us, and to have an expert with us. I just really appreciate all of the insight, the frankness. It was just like sitting in our, just talking to you. So you have any last words that you want to tell the group?
Two things. I'm gonna say my mom would say to everyone, prayerfully proceed, with all of the different things. So I'm gonna send that blessing along. And the other thing is, just to continue that we're here for a reason. We're built for this. You know more than you think you do. And I just want to say I am grateful for every single one of you. And I'm legit sending you love and prayers.
Thank you so much. Thank you, everyone. And we hope that you're on next week.
Mm-hmm.
Bye-bye.